Hi, welcome everyone. We are so glad that you are able to join us tonight, or for those who are joining later, for coming and seeing what we have to share with you all about the importance of this particular historic and political moment that we're in. Some of you actually in this moment might be watching some of the activities for the inauguration. We were super pleased to see that Biden won the presidential race this year. In addition, we won the Senate runoff race, making it a president with both houses of Congress aligned, moving into hopefully a historic year where we can probably roll back some of the things that happened over the 4 years of the Trump presidency, some of the things that have been exposed with this year of the pandemic and an astronomical number of the loss of life in our country. Yeah, a lot of changes, I think, hopefully are on the horizon. We felt that it was a really important opportunity to leverage, to organize physicians who have been particularly hard hit during this pandemic, in how we practice medicine, and how we're able to take care of our patients. Things that were there before, but that got were laid bare really in this the mismanagement of this pandemic. So we thank you for joining us, and I want to just give everyone here an opportunity to introduce themselves. I'm Donna Murphy, and I am one of the co-founders here. We have some who were not able to join us tonight. I'm a physician in Texas, a physician scientist and a community organizer, and we'll just go do the rounds and see who everyone else is who's joined.
I'll go next. My name is Sujin Gogu. I'm a physician in the Rio Grande Valley in Texas, which is on the border with Mexico. And I'm a family physician, a sports physician, and a pain physician. I literally practice everything that's possible just because the area I'm in really needs it. I'll pass it on to Noah.
Hey, good evening, everyone. My name is Noah Rendosa. I'm a physician in Pittsburgh, Pennsylvania. My specialty is minimally invasive gynecology. And it's just a pleasure to be here with all of you this evening and with these fine people here. Justin, to you.
Perfect. Good evening, everyone. I'm Justin. I practice being a medical student in Baltimore, Maryland. I am working toward my MD and my PhD and have been in school for going on 8 years now. But during that time have been heavily involved in a handful of different physician and medical student-based advocacy and social justice related efforts through several different organizations, and haven't really had the opportunity to contribute directly to supporting candidates who are patient-centered and focused on equity justice to run for office, particularly those who are health professionals and physicians in particular. So I've been very excited to be part of the core group in Doctors in Politics.
Hi, my name is Haitham Gwaili. I'm trained in family medicine and psychiatry, but specialize in geriatrics and geriatric psychiatry. And I became very interested in doctors running for office based upon what was happening this past in the pandemic, where we learned that hospital organizations, government had no plan in which to address this pandemic, leaving doctors really bare and healthcare professionals really underserved in the midst of the pandemic. So Doctors in Politics had effort to try to get doctors organized and healthcare workers organized and involved in taking back healthcare for the benefit of our patients from special interest groups. So we are a group that is really committed to running progressive doctor candidates for elected offices up and down the ballot to change the conversation and to organize and put our values into office, which are patient-centered, and focus on what is best for people as opposed to what is best for profits.
Awesome. So I wanted to actually pose this question for all of us to answer, and that is, what responsibility do we have collectively as physicians to reframe all policy as health policy. Why is this the moment in which to do that?
Yeah, Donna, I think it's a really great question, right? We need to move away from this idea that simply having health insurance equates to having good health care, and really start to think about health as the bigger picture, right? Think about the impact of racism on health. Think about the impact of the environment on health, and all these other determinants of health that we've really kind of pushed to the side for far too long. And I think that this is the moment now, because we have really seen during the COVID crisis how much those factors influence people's well-being and overall healthcare outcomes. And I think that we need to really jump into the conversation now. It's been too long that doctors have been on the sidelines and not really directly advocating for our patients at the highest level where the policy is being made. So that, for me, is what drives me to be involved in this work.
Yeah, I think that doctors have often felt that doing the advocacy work that we've done and taking care of patients is sufficient. But I think that what we have learned is that because we have been absent from the conversation, the things that we care about and the things that we know that are contributors to overall health for patients have just been neglected. I think that you don't have to go very far to realize that our public health system is abysmal and does not meet the needs of the majority of our population, that we under-resource. I mean, I think we spend 3% of our total budget on public health. When you think of a country as large as the United States, I think that that is a sad reflection of really our commitment to things that make people well. I think that, now is our time. Never before have we been all suffering at the same time at the hands of failed political policy. So I think that this is really a time that we can really capture, come together, and really advocate for the things that we care about.
And I think I would add that, during medical education, the doctor, one-on-one doctor-patient relationship has been held sacrosanct as part of a core part of our training for so long. And yet, for as long as people have practiced medicine, these social injustices, these environmental factors, these extra political interactions that people have to face on a day-to-day basis are what's impacting their ability to achieve health, their ability to follow our instructions as current and future physicians, our ability to give them advice that they can take action on. We've seen physicians break out of this like bedside one-on-one relationship, organizing for things like gun violence prevention recently, bringing insight to issues with prescription drug affordability, really some piecemeal and kind of policy specific advocacy efforts. But there really hasn't been a crisis that's highlighted how all of these environmentals can intersect together with the health of the people that we take care of every day, as beautifully, or as horribly, I should say, as COVID-19. And so I think this is really our opportunity, not just to highlight just how much those issues intersect, but our ability to show why doctors can combine the stories of the patients that we have with the data and the science that we know should underlie really good progressive public policy, and why they're some of the best messengers to make that happen in political office.
I can speak as being a physician and seeing patients in the room. A lot of the decisions that I make are predicated on external factors that are affecting my patients. I feel like physicians and nurses, we know our patients the best, but oftentimes we haven't been in the advocacy space, fighting for our patients as much as maybe we should. And Doctors in Politics is a group that hopes to get more physicians to join us, to be part of the conversation, to fighting for healthcare for our patients. Currently, as I'm sure many of the physicians that are watching today or notice, is a lot of our patients are being hampered by insurance companies, hospital administration, other technological companies that are out there, DME companies. The list goes on and on. Everyone's in the room when I'm seeing my patient, and it's just too many people in the room. And it really needs to get to the point where it's just the doctor and the patient, and the doctor or nurse that's there as well, that tries to take care of our patient and provide the best care possible for the best outcome at the end of the day.
Mm-hmm. So I don't want to name names here, but there is a specific physician in Congress at the moment who has tried to argue in favor of some things historically that I think ultimately does not serve our patients, right? And I mean, from your perspectives, why do you think that happens? One would think that if you put physicians into policy-making positions, that they would do things that would be in service to their patients. I would think so, but clearly that's not always the case. And I think this is why we have come together around this idea that we want to support physicians who are very explicitly devoted to patient-centered policy, justice-oriented policy, as we like to say here, because not all physicians are this way. Not all physicians in politics are this way.
Yeah, Donna, I think it's a great point. I mean, at the end of the day, medicine is also a huge business, and there's so many conflicting interests that pull us in so many different directions every day in the practice of medicine, right? You have the health insurance companies, you have the pharmaceutical agent companies, and all of these different kind of folks are tugging for the same slices of the pie, and oftentimes it's the patients that end up suffering. I think a lot about all the time that I've spent in Washington lobbying our representatives, and we show up for a day, right? You talk about one specific issue or topic related to the well-being of your patients, but then nobody's advocating on that topic again for possibly another 12 months. And how great would it be if instead of us coming to Washington to spend half a day, we went to Washington and spent 365 days advocating for our patients. Instead of 2 to 3 hours, once a year, if we were there every day, but not just advocating, but actually in the room helping to write these policies. And that's the core of what we're trying to do here, is to really make sure that a group of physicians that are dedicated to our patients and our patients' well-being, first and foremost, over every other special interest group out there, are helping to set the agenda for our patients.
Mm-hmm.
Historically in the United States, I would say that, we, because of decisions we've made to tie healthcare so intimately to business and to profit making, ultimately it's money that talks. And so what we see are the physicians who have gotten most involved in politics traditionally are the ones who are the best at organizing toward the benefit of physicians as a practice and toward the ability of physicians to maximize their profits, alongside other organizations in healthcare that are trying to maximize profit in this terrible healthcare system based on maximizing profits in the United States. That's why you see many libertarian, many conservative voices among the physicians who are most visible in politics. That's not necessarily true in other countries. And I think here it doesn't have to be true either. It's just that the physicians who are not as business oriented haven't been as used to political organizing as those who are more oriented toward the advancement of physicians as a practice.
Mm-hmm.
Yeah, I mean, I think that the examples that we have of doctors currently in Congress is just sad. I mean, we have 18 doctors now that are in Congress. 15 of them are Republican. That's not to say that they don't have some good ideas, but in general, they are not always on the side of the patient. And the truth of the matter is that they are beholden to special interest groups like insurance companies. And I think what's become really clear to doctors and to patients is that the insurance company is the natural enemy to quality healthcare. And really, they are a group of individuals who do absolutely nothing, really absolutely nothing but say no. Their goal is to make money. Their goal is to basically get in between to cut costs. And that's what we're seeing, right? And I think that doctors are incredibly frustrated by it. Now, the people who basically can make insurance companies accountable are legislators. That's who makes those decisions. right? And unless we are basically in those positions to make those decisions and to also have the one-on-one conversations with other legislators who may not understand exactly what it is we go through as doctors and how it impacts patients and their constituents, there will not be a change in this. And I think that this was shown by Haven, which is that group by Bezos and Warren Buffett, where they basically were going to recreate healthcare for their employees in order to cut costs. And the moral of this story is that unless you have political will, unless you have political power, you cannot move healthcare. So we must move healthcare by winning political seats. That is the way that we make everyone accountable and take back healthcare for our patients.
Did anyone else want to comment on that question at all?
No, Heisen put it so well, so I didn't want to add on it.
Yeah, no. So I wanted to say, the challenges I think are gargantuan that we are facing right now because there are many intersecting systems that are will stand as barriers to the kinds of things that we want to see for our patients in doctors and politics, right? So how do you think we are going to accomplish what we want to accomplish, right? I think it is true that the first step is to try to get some of us in the room, right? To try to get a large number of us, hopefully, in fairly short order in the room. What other things? Well, first of all, how can we do that? And what other things are necessary, really, for us to create really transformative change?
So I don't think it necessarily stems from, physicians seeking, congressional power. I think there's a lot to be said for getting power within your own communities, whether that means, getting on your hospital board, whether that's being a medical director of your clinic, whether that means getting on an insurance board, whether that means being part of a school board or being part of city council. There's so many ways that you can make change that really influences your community. So, I would make the argument that, hey, I want every physician that's watching or every physician that's out there to try to seek, some type of leadership role so you can get your voice heard out there.
Mm-hmm.
Being intentional about bringing in a diverse group of voices, both in terms of the voices of physicians who are of different backgrounds, so physicians of color, women physicians as well as men physicians, physicians who are serving different communities, rich and poor, transgender, LGBT, religious minorities, all sorts. And obviously 4 out of 5 men and 3 out of 5 white men on this panel right now, notwithstanding, we've been very intentional at Doctors in Politics about addressing systemic inequality and racism centered in our work. But one of the ways we do that is by lifting up the voices and supporting candidates who are diverse and represent diverse interests. I think most of the physicians who have been in politics visibly have been white men looking out for financial interests of for-profit entities or big organized physician groups. And I think we need to change that fundamentally if we want healthcare to work for our patients in this country.
Yeah, I mean, I think I probably shared the sentiment often, but I fundamentally believe that the most powerful or impactful, the most relevant, certainly, policy will come from those people who are closest to the struggle. And I do think that if we're thinking about all policy as health policy, it means that people impacted by many different kinds of problems need to have a seat at the table. So within our physician community, I think we do have representation from people or of people from many different kinds of communities. And I think that it is really critical to lift those people up, to really help them to get elected into all levels of government, really, as Sujin has alluded to. And I think that in order to do that, we have to build coalitions. Physicians ourselves are not politically engaged enough, at least not yet, to do it alone. So whether that is our colleagues who are scientists running for public office, other progressives or progressive organizations, progressive health organizations, I think that it is really, really critical to build coalitions with those individuals and organizations, which will give us a chance as physicians to get into public office and to support our patients. Do we want to do some of the audience questions? We can pepper them.
Sure, I will. If you guys have questions, feel free to post them in here. But I'm gonna just put it out. I don't know if you guys can see this.
Mm-hmm.
Any thoughts, anybody?
Yeah, so there's a few different ways to interpret that question. I'm not sure if I'm getting exactly at what the what our guest is talking about. I think one way to think about this is, as physicians, do we have a way to organize legally that allows us to gain political power and to further our goals? I think we're starting to see efforts at unionization, both among physicians and residents, as well as nurses, as well as other frontline healthcare workers, some of which has been accelerated by this pandemic. And those efforts have come in fits and starts, struggling against large healthcare institutions. But I do think that is one way to kind of get legal recognition for those efforts. I think the creation of organizations that have diverse goals and diverse abilities from a legal perspective to do advocacy is important. So I mentioned several of us work for nonprofit or 501c3 based policy organizations that really help try to bring attention to issues and how they're affecting patient care. But the creation of entities that can be more overtly political, can put money behind candidates who are in favor of change in the healthcare system, in favor of allowing physicians to provide equitable and just and accessible care to their patients, and really further the practice of medicine in that way, like 501c4s or political action committees like Doctors in Politics. I think that is important as well. There is always a struggle of physicians speaking up and having a voice within their own healthcare institutions. I'm sure when they do speak up, they have legal cover and an employer and are free from repercussions from their employers. And we've seen some problems with that, particularly highlighted by the pandemic, which I know some of the other panelists can speak to. But so there's a few different things to think about there that I think are moving. It's a very dynamic and exciting time to be in this work.
Did we want to? Oh, sorry. Go ahead.
Yeah, I mean, I think to this question, I think maybe what you're alluding to is that when doctors use their voice, that hospital organizations fire them. And do we have the ability to voice our concerns and not receive consequences for speaking the truth? And what I will say is that this is obviously a really important topic. I think that what we're seeing is the silencing of doctors and on a public level, and sort of this slow process of trying to devalue doctors. We see politicians do it all the time. We see a group of doctors come out and basically sound absurd, all to delegitimize sort of what we're doing. And then now most recently, what we're seeing is that anytime a doctor speaks out, they basically get fired. And this is a huge, huge problem, right? This obviously says this is a fundamental problem in our system. And myself, I'm going through it right now and trying to figure out sort of like what options I have. But I think the truth is you always speak the truth, right? You have to speak the truth, right? Because in my opinion, you have to do the right thing. Right, you always do the right thing, and whatever the consequences are the consequences. You do the right thing first, and then you address the consequences later. So, anyway,
Yeah, I will say that this to me is that the problem is very much akin to kind of the vulnerability I see in the immigration like advocacy work that I do, because often, they can speak out, but they are vulnerable. They're exceptionally vulnerable when they do so. There is something to be gained potentially if they speak out and they're heard, right? If we make a lot of noise around the problem, sometimes action is taken. But you run a risk, and it's a pretty significant risk there. And I think even for physicians who speak out and they lose their livelihoods, right, that is a significant risk. And I think what it requires is the community around them, the community of physicians and other health workers who organize to support that person to do the right thing. Right? Whatever that looks like, whether it means that we do a GoFundMe to cover legal costs, and we've done this, right? Like for what happened to Dr. Curry, she had a lot of grassroots mobilization around, her episode with her employer, where she was fired basically for talking about the very thing they had asked her to talk about, which is racism, right? And in medicine, and that is absurd to me, but it happened. And what followed was that we organized a response, right? And we supported her. And that's how we get through it, right? That's how collectively we move towards something that is more just. But we have to be committed to it, right? Because if there aren't enough people who are committed to it, individuals will really suffer pretty profoundly. And communities, entire communities too. So, so I wanted to just wrap up here. I'm sorry I'm not able to get to all these other questions. Maybe we can make an attempt to kind of type the answers out once we've published this or released it as a video maybe on our Facebook page or Facebook group. But I wanted to kind of close with an invitation to the people who have caught this episode or this Facebook Live. We are growing our organization. What you see here, we do every Tuesday and Thursday night. Okay, maybe not in such a lofty way. We kind of know where we fall on a lot of these questions at this point, because we've been working together many, I guess, hundreds of hours, if not thousands of hours at this point over the last year. But we have a fantastic time just figuring out like what something radically different looks like, and how to potentially get there. And I think a lot of that is like how we converge around certain values that we try to live and that we try to promote through our organization and through the candidates that we support. So I really hope that people reach out. If you go to our website, doctorsandpolitics.org, you can sign up to be a volunteer of any kind, really. The sky's the limit, I guess. It's your imagination that limits you. And we'd love to see you here. We're going to have these Facebook Lives. We have them every Tuesday as COVID updates typically. On Thursdays, we're going to have some in the coming weeks that are more specific to the day-to-day, well, actually, more generally about running for office. So we'll have people who've run as candidates, who've been former electeds or who are currently in elected office, speaking, from the level of local government, state government, and federal offices as well. And we will have them talking broadly about why they decided to do it, and what the barriers were and what resulted in some of their successes, what they consider success to look like. And then we'll also have some more specific Facebook Lives about the specific levels of government and kind of what the day-to-day is for those people, so that all of you who join us, who have even an inkling of interest for yourself, or potentially you're thinking about someone who might be a good candidate for public office, you'll have an idea of what that means. Because I think too often physicians are not aware of what that means, really. And so we want to kind of put that out there so that people can start thinking about doing it. Anyway, thank you very much. Does anybody else have anything else to say tonight before we close?
No, join us.
Yes.
Join us.
Thank you so much, guys.
Thank you.
Thank
Have a
you,
great night,
guys.
everyone.
Thank you guys.
Bye-bye.
All right, bye.